investigated. Despite the ongoing global response to the COVID-19 pandemic, we cannot lose sight of other significant public health issues, including influenza. Influenza affects every country every year and takes its own deadly toll. As we enter the Southern Hemisphere influenza season, influenza affects every country every year and takes its own deadly toll. As we enter the Southern Hemisphere influenza season and begin planning for the Northern Hemisphere season, we must ensure that WHO influenza affects every country every year and takes its own deadly toll. As we enter the Southern Hemisphere influenza season, on the composition of flu vaccines. These recommendations are based on data and virus samples collected and analyzed by the preparedness framework. And I would also like to thank the public and private sector partners that participate in this global system. The infrastructure, people, skills, and experience built up through GISRI's WHO collaborating centers partners that participate in this global system. And there has been a sharp decline in sharing of influenza information and viruses because of the COVID-19 pandemic. Genetic sequence data uploaded to the GISAID database. These decreases are due to a combination of issues, including the repurposing of staff and supplies, overburdened laboratories, and transport restrictions. These disruptions may have short and long-term effects, such as loss of capacities to detect and report new influenza viruses with pandemic potential. You know, twice a year, WHO convenes a group of genetic sequence data uploaded to the of experts who together analyze the circulating flu strains. Are due to a combination of issues, including cases of flu and more deaths. WHO has published guidance on how to integrate surveillance for COVID-19 into routine influenza surveillance as an efficient way to track both of these important respiratory viruses. This is not only cost-effective, it's also essential for protecting the world against the next flu season. The Southern Hemisphere flu season is already underway. There is no time to lose. I thank you.
Many thanks, Dr. Tedros. As I have announced, we will start with the Brazil, we have Guillermo Bianchini from Estadão online. Guillermo, if you can just unmute yourself. Hello.
Hello.
Yes, we can hear you.
Oh, okay. So my question is about Brazil. I want to know if Brazil can be considered the new epicenter of the COVID-19.
Thank you, Guillermo. If I understand well, the question was, should we consider Brazil as a new epicenter of COVID-19?
I think Chile and others who've had significant increases in cases and continue to have an upswinging epidemic. So I would characterize the situation in Central and South America as being of concern. And currently our America's regional office, the Pan American Health Organization, is providing day-to-day support to a number of countries in Central and South America, both in terms of their public health measures and supporting the health systems in those countries. So no, I would not characterize
We have Yi Lu online from Chinese TV Phoenix. Can you hear us?
Yes.
Yes, please.
Hello, everyone. Can you hear me?
Yes, very well.
Oh, okay. I'm Ilu from Hong Kong Phoenix Weekly. My question is about the outbreak in Beijing. We wonder, is it possible for the novel coronavirus to spread across the country by adhering to the surface of important goods like salmon or something else? If yes, do you think it's necessary to add the coronavirus testing for import and export goods? Thank you.
Yeah. I can start. I think we obviously need to look at the issue of food or food packaging, but we also need to recognize that the common things are common. We know this disease is primarily spread from human to human by the respiratory route and the contamination by humans of that environment. We've also seen that this disease can breach the animal, needs to be further tested. But I would be reticent to be in a position where, and we need to understand what is actually before with authorities in China to understand what exactly the risks are here, and will issue any guidance internationally accordingly.
And thanks, Yilu, for this question from Phoenix, Hong Kong. Now we will go to Bloomberg.
is it important whether a plane is full? And, how can people protect themselves?
World and mass gathering movements around how risks can be reduced in that. So in this regard, we've been working to give advice on how risks can be managed in a air transport environment, and that both is covers for a traveller on any form of transport. I suppose the key issue is what the traveller themselves can do to protect their own health, and then what the authorities can do at airports or on aircraft to reduce the risk of transmission. And again, let us remember, and we've seen, there is no zero risk in any environment. What we need to do is identify the risks that may be involved, or the increased risks that may be associated with travel. We need to try and reduce those risks to the absolute minimum and be able to mitigate any negative impacts. So it is difficult, for example, it is quite reasonably straightforward within an airport environment, although logistically difficult, to create physical or push together in a much closer environment. And I think you'll see that airlines and the air travel associations are putting together all kinds of guidance and extra hygiene and extra cleaning and boarding procedures and all kinds of different procedures that are aimed at reducing risk, including the wearing of masks while on the aeroplane. Again, all of those are aimed at giving the passenger a safe travel experience. And then I've made %100% safe, and therefore we need the capacity to will be issuing further guidance on this. And as I say, I can assure you, we are working very closely with the International Civil Aviation and the Air Transport Associations to ensure that we give them the best possible risk management advice in this space. Maria?
Many thanks, Dr. Ryan. Now we will go to South Africa broadcaster. We have Sophie Mokoena. Sophie, can you hear us?
Yes, I can hear you, sir. I just want to find out, recently we've seen in many countries where there has been protest. Now have to deal with issues of infection in their respective countries where we have seen a wave of protests.
So thank you very much for this important question. So yeah, we have issued some guidance around the planning of mass gatherings, whether these are planned events or whether these are spontaneous events, to help organizers hold these in a way that can minimize the risk for COVID-19 and for other infectious diseases. And some of the considerations that need to be taken into account to help those organizers, whether they're planned or spontaneous, takes into account what is the disease, the virus circulation in that area. Is it an area of active transmission? Is there a way in which people can remain physically distanced? They can be at least a meter apart. Should they be wearing a fabric mask when they're out? And is there a way to quickly be able to detect cases and monitor those cases if someone is sick? It is important that anyone attending an event, whatever event that may be, that if they're unwell, they stay home. And if they are in a place where they cannot maintain physical distancing, to wear a fabric mask to prevent the potential onward transmission. But any opportunity where people are in crowded places and the virus is present and the appropriate measures are not put in place, the virus can take hold, the virus can transmit. So
if not, we may come back to Tomo from Kyoto. Now we'll go to BMJ, and we have Jonathan Owen. Jonathan, please unmute yourself, Jonathan.
Good afternoon.
Yes.
With the situation in Beijing, just wondered if you could tell me, are there any plans to mobilize any medical teams to assist, and could we be seeing the start of a second wave there in Beijing? Is that a concern?
I think, as we've seen in many countries, the emergence of new clusters, especially when the origin of the cluster or the driver of the cluster is not recognised, is always a concern. But what we do like to see is an immediate response to that and a comprehensive set of other migrant dormitories and many other environments in which this has occurred. However, Beijing is a large city in a very dynamic and connected city, so there's always a concern. And I think you can see that level of concern in the response of the Chinese authorities. So we are tracking that very closely. Our country office, and remember, we do have a team in China that's actually based in Beijing. Our country office there is led by our country representative, Dr. Gauden Galea, and we have a number of epidemiologists as the investigation develops, and are working directly with colleagues again at China CDC on some of the more important findings like genetic sequencing and other investigations that will be important to understand the origin and spread of this disease. Maria?
yeah, I just want to highlight, not particularly on Beijing, but in all countries, that have had some success at suppressing transmission, have been able to reduce transmission to a low level or eliminate it. All countries need to remain at the ready. And so it's very important that countries have the systems in place to be able to quickly identify any suspect cases and test those cases and follow the same pattern of events that need to happen. Make sure, we test, isolate, trace contacts, quarantine contacts, so that any resurgence can be picked up quickly and can be stamped out. And I think that's an important message. It relates to even the first question, to be on alert, and Beijing has activated their systems. We've seen similar situations with Singapore, with Japan, with Germany, with many countries. And so it's just important that everybody remains at the ready to be able to quickly detect and care for those patients and do contact tracing appropriately.
Thank you. We will now go. We'll go.
Condemning racism. And I just wanted to know what WHO is doing to fight racism within the WHO, and also when it comes to testing and everything related to COVID-19. Thank you. To express our voice, to condemn racism and any form of discrimination. As you know, racism and any form of discrimination should not be tolerated, and it's through addressing these two problems, actually, we can bring peace and stability to the world. So that's why we raised our voices. Of discrimination should be condemned and should be fought, and we need our position. I think last week during our presser I have already indicated or clarified WHO's position. WHO's position is for equality, and we will do everything to make sure that this happens in WHO and everywhere as members of the global community. Thank you.
Thank you, Dr. Tedros. We'll go now to AFP. We have Agnes Pedrero. Agnes, if you unmute yourself, we will be able to hear you.
Yes, hello. Do you hear me?
Yes.
Yes, hi. Thank you for taking the questions, even if I think it was partly answered. But I wanted to ask you what level of concern you have with the fresh cluster of cases in Beijing. And when you talked about the more than 3...
sovereign countries investigate and respond to epidemics on their territory and request assistance from WHO as needed. We are always, and in every case when there's an epidemic or a new epidemic in countries, we always offer assistance, technical, operational, and logistic as needed. In this particular case, And I think in the case of this response, I think Chinese authorities, as many countries around the world, again, like Korea, like Japan, like so many other countries, have learned many lessons in the last 6 months in how to handle COVID all over the world, and I think have built significant capacity in doing that. However, we will continue to monitor the situation, continue to offer that assistance and continue to make information available to the international community. As we
significant, and every single case needs to be followed up and cared for appropriately. But clusters are a special condition because in any country, we need to understand why is there the clustering? What brought these cases together? Is it related to an expat dormitory? Is it related to a healthcare facility? We are witnessing many countries apply the fundamentals of public health, of outbreak investigation, which public health professionals are trained to do to find cases, to understand the extent of infection by doing active testing, and to follow up on all of the cases and contacts and care for
circumstances and the context and the behaviours in which disease transmits more readily. And I would point you to, we've had some excellent articles come out in the last couple of days, one in the MMWR from the CDC in Atlanta, from Fruz and et al., Japanese colleagues who've done extensive cluster-based investigations looking for specific risk factors and specific situations and behaviours and contexts in which transmission, exhaustive investigation of disease clusters to really look at what is happening in these situations and then what is causing amplification of disease in the human context. And if we get that, we will build up a much better picture of the public health advice we need to give our communities on what behaviours to avoid, on what places to avoid, on what circumstances to avoid, and for us in public health to have better policies to guide government. So I do think this is an important issue in as much as it demonstrates that rapid